Hello. We did our project on cirrhosis in Ethiopia, and today presenting we have Maria Wiles, Rebecca Fiorillo, Aileen Soto, Catie Moat, and Rachael Martin. And so to get started, a little bit on cirrhosis. Cirrhosis is the term used for advanced scarring of the liver caused by advanced staging of various diseases like hepatitis B, hepatitis C, chronic alcoholism, and fat depositing in the liver called non-alcoholic fatty liver disease. And while there can be many disease processes that result in cirrhosis, these four are some of the top cirrhosis causing diseases. And so the clinical course of cirrhosis, there are two stages to cirrhosis, compensated and decompensated. In the compensated stage, the patient usually is asymptomatic and may have no clue their liver is injured and becoming irreversibly scarred. So in this compensated stage, the first stage, patients can maintain a healthy quality of life for about 10 to 12 years since they do not show any clinical signs of liver damage. However, the second stage, called the decompensated stage, is where the clinical manifestations of cirrhosis begin to develop. This stage is when the liver is failing to function normally and the effects of the rising portal hypertension begin to be seen. These manifestations can include ascites, jaundice, and eventually hepatic encephalopathy. And once a person is in this decompensated phase, that person has around 2 to 4 years of life left. And so while cirrhosis is irreversible, treatment can be done to prevent the disease from progressing further and worsening by treating the underlying causes of the liver scarring, whether that be hepatitis B or chronic alcoholism. Exacerbations and complications can be managed to prevent further scarring. So while cirrhosis can be a frightening diagnosis, the good thing is that it can be prevented. Some lifestyle changes that can be made to reduce the risk of developing cirrhosis can include drinking alcohol modestly. If you already have cirrhosis, to avoid alcohol altogether. Reduce the amount of foods high in saturated fats and choose lean proteins, whole grains, and fruits and vegetables in order to maintain a healthy weight. And if you if you're not a healthy weight right now, you can set up a weight loss program with your doctor. In some ways to prevent contracting hepatitis B and C, since they are some main causes of cirrhosis. These ways include not sharing needles, not having unprotected sex with multiple partners, and staying up to date on hepatitis vaccinations and just all vaccines in general.
So some factors that relate to cirrhosis in Ethiopia specifically. First, for social factors, there's been an increasing amount of alcohol abuse. What was once 0.5 liters a year per person has become 10 liters a year. And alcohol, as you know, can aggravate or cause the chronic liver disease, which leads to cirrhosis, and it actually promotes the rapid progression of liver disease. There's also been an increasing amount of advertisements showing drinking as leading to success in all aspects of life, and it especially caters to young people. There is a higher prevalence of alcohol abuse in men in Ethiopia, and 1/5 are current lifetime alcohol users. For environmental factors that lead to cirrhosis in Ethiopia, there are parasitic infections with schistosomiasis, which is a factor in developing cirrhosis, and then hepatitis infections from lack of clean water and sanitation. Another interesting environmental factor is contaminated grains and crops with chemicals or weeds that have naturally occurring plant-based liver toxins. And then the people are just eating the weeds when they collect the crops, and then the weeds are getting into the crop products, and then they're eating it. And the liver toxin is called pyrrolizidine. And so that's getting into the food sources of people. At an individual level or country level, there is a high cost of treatment for cirrhosis and hepatitis, and there's lack of access to hepatitis B and C vaccines.
There's some local and global policies. Oh, my bad. Some local and global policies, the local ones including increasing the legal drinking age to age 19, increasing the taxes on beers, wines, and spirits, having generalized screening and testing for Hep B and C, including HBV at first. Some global policies, including resource mobilization, increasing hepatitis surveillance, and increasing first dose coverage of HPV vaccines.
So some determinants of health would include diet and lifestyle choice, non-alcoholic fatty liver disease, and viral hepatitis infection. The two big determinants of health would be the diet and lifestyle choice and viral hepatitis infection. And those are considered more social environmental, like Maria touched on. And the non-alcoholic fatty liver disease would be more of a genetic one. There's been a high correlation between developing developing cirrhosis as a result of fatty liver disease. That's not caused by alcohol.
So some global regulations and prevention efforts. There's increased education on lifestyle modification to prevent this. Hepatitis vaccine is more accessible than it used to be. And then related to alcohol, there's more control on advertisements, and they restrict purchase access at certain hours, and there's increased tax on purchasing alcohol. So all this prevents globally.
Some local prevention tactics, mostly related to all the factors related to cirrhosis, are to treat hepatitis or parasitic infections early so that the liver doesn't become involved. It's also important for healthcare workers to stress how to weed crops for farming families to reduce the toxins in food sources from the weeds that contain pyrrolizidine. And then to also reduce advertisements geared towards alcohol use, especially to young people. So that is cirrhosis in Ethiopia.